Hello, and welcome to today's webinar, Optimizing Lab Services. My name is Samantha Burke, and I'm the Administrative Director here at NERUCA. Now, before we dive in, just a few quick housekeeping items. So today's session is being recorded, and we'll take questions at the end, so please do use that Q&A chat box to submit them at any time. Now, for those of you who don't know or who are new to NERUCA, we're now in our 12th year of existence, and we work to really provide grassroots representation across the Northeast in partnership with UCA. We address urgent care legislation at the state level. We integrate urgent care into broader public health initiatives, and we offer advocacy and education for urgent care professionals like you. Now, we support this work through programming like today's webinar and our annual conference, which is our signature event. So this year, it'll be held September 28th through the 30th at Foxwoods Resort and Casino in Connecticut. So we hope to see you there. And a big thank you to our platinum sponsors for making today possible. Shout out to Aptitude Medical Systems, BD, Exdion, HealthTrack RX, Stat Biomedical, Solve, and today's featured sponsor, Medline. Now, if you're interested in sponsoring or exhibiting or speaking, please do keep an eye out for follow-up communications, or always feel free to email us anytime at admin@neruca.org. And with that, it is my distinct pleasure to introduce today's presenter, Brett Miller.
Awesome. Thank you, Samantha, and thanks to NERUCA and to the sponsors for hosting today's webinar. Today we're going to be talking about and spending the next hour discussing optimizing your laboratory services, so optimizing laboratory diagnostics. Before we jump into it, just a little bit about myself. My name is Brett Miller, and I am our divisional manager here at Medline Industries, large healthcare manufacturer distributor that's been around for 100 years. I have been with Medline almost 12 years now and supporting our diagnostics division in a few different capacities. But as of most recently, I manage a team of consultants that spread across the eastern part of the United States. And our team of consultants oversee and work and support in the acute care and the non-acute care market. Interestingly enough, over the last decade that I've been in the diagnostics market here at Medline, the urgent care market has been one of our fastest growing units within the segments that we support. So excited to be here, passionate about the diagnostic space, and looking forward to the webinar today. So as we dive into it, what does laboratory optimization mean? This is a pretty broad term. When you think about laboratory optimization, this could be relating to enhancing and making the process more efficient from samples that are being sent out from your urgent care to the reference lab, and really how we optimize and enhance that process. But today, what we're really going to be focusing on is optimizing laboratory services and laboratory diagnostic services that the urgent care is performing in office. So how can we enhance and improve those services that are being offered today to your patients when they walk in the door? What does lab optimization mean? When we're working and supporting customers in the urgent care market, we're looking at implementing meaningful protocols and practices specific to lab diagnostics that helps your urgent care operate at the greatest level possible. The three things that we pride ourselves and we really work towards is clinical, utility, operational, and financial. When evaluating and improving laboratory diagnostics, we really want to look at performing the highest level of care, all while having a positive impact on the bottom line. Before we jump into kind of the objectives for today's, kind of what we're going to be discussing over the next 60 minutes, I did want to touch on the benefits of laboratory diagnostics testing. What could this mean to your patients, to your organization? Really, what's in it for you? First and foremost, I think it's important to understand that the urgent care market is a patient satisfaction market, period. It's extremely important to make sure that we are exceeding customers' expectations and providing a good quality of care. And one of the big benefits of on-site lab diagnostics testing in an urgent care setting is enhanced patient convenience and patient experience. Being able to deliver faster diagnostics and faster treatment plans to these patients is a huge benefit. Patients love a one-stop shop. Another big advantage is cost effectiveness and efficiency. The more testing you're performing in the urgent care, the more control you have over costs that your patients may be incurring. So it allows more control over for the cost that your patients versus some of the testing that might be getting sent out. You really have no control over what those patients are going to be charged for those diagnostic services. This allows you to control that, but also making things more efficient. Interestingly enough, I was speaking with an urgent care owner in the Northeast in the New Jersey area a couple months ago, owns a few clinics. He mentioned to me in conversation that almost 5% of the samples that they send out to a reference lab, he needs to recollect due to various factors, whether it's lost in transportation or that reference lab was unable to perform or result that patient specimen due to how it was handled or due to the sample. But again, when we look at making things more efficient, bringing and performing on-site lab testing can really drive efficiency and also cost effectiveness. And last but not least, patient outcomes. This is always first and foremost. We really want to look at how we can increase and improve patient outcomes by delivering patient results while they're in the practice can be a huge benefit to providing better quality of care. So what are we going to be talking about today? First and foremost, I'm going to talk about the trends driving the need for lab optimization. Urgent cares across the country that our team is working with, they all operate a little bit differently, but there are a ton of similarities when we look at the trends that are driving the need. So what are we hearing and seeing from customers that's really driving the conversation that we need to be having about how can we enhance and improve and optimize the laboratory diagnostic services that we're offering today? I'm going to be talking about best practices for optimizing lab diagnostics, understanding the what and the why, the business impacts. So what type of impact can this have from a business standpoint, and also going to be touching a little bit on marketing and creating a competitive advantage. Like I mentioned, I've been in the diagnostic space for almost a decade here at Medline. I'm extremely passionate about this space. This is a statistic that I'm sure many of you have seen or heard. If not, you probably hear this often. But this really speaks to my passion in the industry in the lab diagnostics market. But 70% of decisions that physicians make in healthcare are based on laboratory results, laboratory tests. This is why, making sure that we have an efficient and effective lab service offering, it's critical for meeting those customers' expectations and delivering high quality care. We're going to discuss how evolving lab diagnostic services can have a positive impact on your patients and your laboratory. And it doesn't have to be a drain on the business to elevate and enhance your laboratory diagnostics offering. So as we dig in a little bit to the trends, this is, again, kind of setting the stone for why we're having these conversations with urgent cares, big and small across the country. Volume is one of the biggest challenges that urgent cares face today. While there are a lot of urgent cares out there that have very good numbers in terms of volume, it's still a top priority. The overall well-being of a practice can depend on volume. We do hear this often as well, that revenue equals volume times rate. While rate can be a pretty fixed cost when we look at employee overhead for the organization, and also, reimbursements, typically a fixed cost, negotiated fee schedules or negotiated payments for certain services. But as we get through this webinar, I'd really like you all to try to think about how laboratory services, based on what I'm going to be talking about today, how can we improve volume? How can we increase volume? And how can we have an impact on rate by potentially driving in new laboratory services or enhancing current laboratory services? Reimbursements and financial burdens. I'm sure everyone sees and feels this. The way in which urgent cares are collecting reimbursement continues to evolve. As costs rise and become more unpredictable, we really need to start looking at services and solutions to combat this. Staffing, again, a lot of folks are feeling the challenges around staffing. This is something that some urgent cares are in a good spot, but others are really struggling with staffing, whether it's clinical administration. We all see and feel these impacts. It's really important to find the right balance of laboratory diagnostic services based on the current staffing levels, based on the current staffing of the urgent care organization. Barriers to care. I'll touch a little bit more about this later on in the webinar, but we've started to see a trend or a shift in working with urgent cares in adding additional models of care to their practice due to barriers to care in other market segments. So it's important to see these trends, and it's important to capitalize on them if it makes sense clinically, financially, and operationally for the practice. Last but not least, and again, most importantly, patient outcomes. We want to continue to increase the level of care that our clients, that our customers are providing their patients, and this is really driving a need for conversations to be had about optimizing diagnostic services. We're going to jump into best practices. So understanding the what and the why. Before we do, I did want to share this. So according to 2024 CMS data, there's almost 34,000 non-waived physician office laboratories in the United States. Around 19,000 of those are performing under a PPM license, which is a provider performed microscopy. This could be a pap smear, a wet mount, urine sediment examination, or nasal smears for granulocytes. Those are the common services we see under a PPM license. But that leaves around 15,000 physician office laboratories that operate in the United States under a non-waived laboratory under compliance or accreditation. This is an example here from a clinic in the Southeast. Today, my office lab performs CBC diffs with an average turnaround time of 5 minutes. These labs offer better accuracy and reproducibility and only require a single smart person with the right attitude. A great example about a clinic that is providing CBCs within 5 minutes to really elevate and enhance the patient experience, patient outcomes. Good example of a clinic performing lab diagnostic services on site. When we look at best practices for lab diagnostics optimization, I'm going to be talking about the what and the why, and consideration and tactics around expanding lab services, and why knowing new technologies in the market and keeping up to date on new technologies is extremely important. First and foremost, from a regulation standpoint, understanding waived versus non-waived testing. I'm going to talk a little bit more about this in a couple slides, but it's really important to understand what are the limitations of waived testing, what are the challenges for non-waived testing, to make educated decisions on how this is going to impact your organization from a clinical standpoint and from a financial standpoint. We do have to understand the regulations around this. Clinical utility and methodologies. So understanding what tests you'd like to perform, what tests you'd like to increase or decrease your turnaround time. So you'd like to have a quicker result, but also what's the best method for that test. As you know, there's different test methods out there for different tests. So understanding what makes the most sense for your practice is key to understand what's in the market. Practice patterns and workflows. So understanding what are the current practice patterns today. Once that patient walks through your door to leaving, how are they triaged, and how are you fitting in diagnostics testing into current practice patterns and workflows, and really understanding how we might need to modify that to increase patient care by offering different diagnostic services. I'll talk a little bit more about fee-for-service and case rate, but obviously the financial component, understanding the financial aspect is key and very critical, and space considerations. I'll also dig in a little bit more to space considerations. Secondly, discussing and looking at expanding services. So what to consider around the opportunity to expand laboratory services, diversifying laboratory diagnostic services, on-site testing versus outsourcing. So really understanding what tests you may be sending out today, what are customers being charged, or what are they being billed for those tests today, and what might make sense to look at bringing on site. Adapting to trends around barriers to care. I touched on this a little bit and talk a little more about this later on. And understanding the pros and cons of a core laboratory or a laboratory space designated for routine laboratory testing. Lastly, leveraging new technologies. Having an idea of what new technology is out there to help your lab evolve and stay innovative. Lab testing technologies continues to change and improve. There's a lot more instruments on the market over the last decade under a CLIA-waived license. So really enabling practices to be able to offer more lab diagnostic services under a CLIA-waived license. And again, understanding the waived and non-waived pros and cons when we look at technology offered in the marketplace today. Some quick data. So this is some data collected on over 8,000 urgent cares. It was found that approximately 93% perform lab testing on site. Majority of those centers that are performing lab testing are operating under a CLIA waived license, over 87%. And interestingly, nearly 2 in 5 urgent cares provide tests designated under a moderately complex license. This is some data from Xperity, so pulled from Xperity EMR from 2024. Approximately 43% of visits involved a lab test. Of those visits with lab, more than 85% were performed in-house within the clinic. And the average visit that had a lab involved 2 laboratory tests. So as we dig in a little bit to understanding the diagnostics market, again, when we look at enhancing and optimizing our lab services, these are a lot of key components that we really want to understand when we're looking at making decisions. I talked a little bit about waived versus non-waived, but we want to look from a regulatory standpoint. What are the personnel requirements? What are the costs associated with waived testing versus the costs associated with moderately complex testing? What are the QC requirements? You obviously need to perform QC, whether it's a waived test or a non-waived test, but the QC requirements might differ between those 2 licenses. Quality assessment and competency training requirements. Again, we need a competency test to be done for waived testing, but it might look a little bit different versus moderately complex testing. When we talk about methodologies, antigen versus molecular, understanding what are the pros and cons of each. Generally speaking, antigen tests are lower cost, quicker tests results in just a few minutes, but you may be giving up some sensitivity or specificity to have that result in just a couple minutes at a very low cost. On the flip side, if we look at molecular testing, generally it's a little bit more expensive. It also reimburses a little bit more, but gold standard when we look at performance, sensitivity, and specificity. And I understand there's a right place for each of these tests depending on the needs of the urgent care, but it's important to understand and evaluate these different methodologies for the different tests and really weigh the pros and cons. Point of care testing versus traditional lab testing. So understanding the limitations and obstacles of each is very important. When is a test needed stat? We cannot wait a day or 2 days for that. We really need to look at a point of care test versus maybe a traditional method of testing or sending to a core laboratory, understanding if that routine test maybe doesn't need to be run stat. Understanding from a diagnostic standpoint, the financial component, so cash pay versus insurance or fee for schedule or case rate. I'll talk a little bit more about this later on. CLIA versus COLA and CAP. So understanding the differences if you wanted to work with CLIA, which is you are working with the state body for your licensure versus an accreditation firm like COLA or CAP. COLA or cap, there may be fees associated with it. Some may be a little bit more stringent on different aspects of their the business. But understanding what those services are, what you may and may not get for those costs is important when we talk about an accreditation firm. It's extremely important to understand lab services that you perform in-house today and what you send out. And of those send outs, what's available today to be performed on a device that may be sample to answer. When I talk about sample to answer, I'm really referring to point of care cartridge-based, very simple to use, versus multi-step workflow. There may be a pipetting step that needs to happen, or there may be a heating lysis step that needs to happen before putting that sample onto the instrument for a result. But it's important to understand the workflows of these different diagnostic services that you may be considering. And we would talk waived versus non-waived, not from a regulatory standpoint, but from a test menu standpoint. Like I mentioned about technologies, it continues to evolve. So we are seeing a lot of testing being able to be performed under that waived licensure. But there are limitations to some of those tests. And there are also a lot of tests that just still cannot be performed under that licensure. So understanding that piece is critical when making decisions. So talking a little bit more about CLIA waived versus non-waived, again, it's important to understand this if you are looking to enhance or move to moderately complex. When we think CLIA waived testing, these are generally kit-based tests, small, easy to run analyzers. There's no technical skill required to perform CLIA waived testing. The fees associated with the licensure are very minimal. We're talking under $200 to apply for a CLIA waived license. These are renewed every 2 years. So every 24 months, it's a couple $100. There's also no required inspection for CLIA waived laboratory. When we look at non-waived or moderate or highly complex laboratories, generally speaking, the equipment being used is a little bit more expensive, but a little bit less cost to operate due to the way that the instruments are run, liquid bulk reagent. But training and quality control and quality assessments are required, maybe a little bit more so than the CLIA waived licensure. The fees associated with moderately complex license are obviously a little more as well. This can range from a few $100s to a few $1,000, depending on what tests are all being performed and the volume of tests that are being performed. A couple of the key differences here too. Moderately complex laboratories do require an inspection every 2 years. So every 2 years you will be inspected by either CLIA or your accreditation firm. And it also requires a laboratory director with some specific experience needed. The regulations did change a little bit here in 2025, but those are some of the key differences from a CLIA waived laboratory versus a moderately complex laboratory. I talked a little bit about space considerations. You know, when looking to optimize lab services, it's key to understand space considerations for both waived and non-waived. While CLIA does not dictate actual square footage requirements, it is key to know what testing and what type of equipment you're looking into so that we can make sure that the space is sufficient for what you're looking at. When we look at number of tests being performed and the number of instrumentation or devices that might be needed, if you're performing 10 or 15 strep tests per day and you're looking at a CLIA waived device, you may need multiple platforms, whether it's 2 or 4 or 6 platforms running these tests. So it's important to understand, based on your needs, what work area would allocate enough space for the instrumentation. Also, from a storage standpoint, are the reagents, are any of the consumables refrigerated? Do we need cold storage for the reagents or consumables? Important to understand that. When we looked at non-wave testing, there are some key differences here. Generally speaking, laboratory equipment under the moderate or highly complex licensure, there is maybe some electrical that needs to be enhanced, whether it's a 220 versus 110, heating and cooling, plumbing. Some instruments do require being within 15 feet of a drain. So understanding some of the aspects around the instrumentation that you might be looking at is key. And from a workflow standpoint, making sure that the instrumentation in the workflow in your laboratory works. Our team was supporting a urgent care group down in the New Mexico area, and one of the things they now perform CBCs in all of their urgent cares today. But as we worked through the process of getting them up and running, their humidity was a factor. Obviously, being down in New Mexico, dry area, typically CBC instruments need to be within a minimum of 30% humidity to operate efficiently and effectively. So we did have to work with their quality team to put humidifiers in their laboratories to make sure that their CBC instruments were performing. So just some of the things that we want to make sure that we're considering from a space and environmental standpoint. All right, from a financial perspective, it's important to know this, obviously, this side of the business. It's key to know who pays and what's being paid. Around 60% of urgent cares we've seen fall under the fee-for-service model, while close to 40% fall under the case rate model. Something that my team does frequently for our clients is running annual pro formas. This is something that we're able to show our clients to the penny costs and cost per reportables for the different diagnostic services that they offer. This really provides a lot of transparency into what true operational costs are for these lab services so that we can make educated decisions based on a case rate that you may be collecting or a fee for service, what these codes might be billing and collecting for these different diagnostic services. But it's important to understand the differences between these. Fee for service can be advantageous for clinics with a diverse service and more complex cases due to the ability to bill for those different services being offered. While case rates, with more complex cases, it may not cover all the costs that you'd like to offer the patient. So working through this is really important to make sure that from a financial standpoint, decisions are being made based on the business. All right, so as we move to discussing consideration and tactics around expanding lab services, I do want to note that there's not really a one-size-fits-all approach when we're looking at optimizing lab services. It's a similar exercise when consulting with clients, but really to capitalize on many of the benefits of on-site lab testing, you have to understand the current landscape of services being offered in-house versus what's being sent out to a reference lab. This pie graph here is from Xperity EMR data from 2024. This shows the top tests performed in-house in the urgent care market. In a breakdown of those tests, I'm sure everyone can relate to these. And one thing to note that the respiratory, we do have strep bundled into the respiratory there. So that's strep, flu, COVID, and RSV, followed by urinalysis, pregnancy, drugs of abuse or drug testing, and mono. On the flip side, this is also in no particular order. I do believe STIs was one of the top 2 sendouts from the data that we had, but this is in no particular order. STIs, CBCs, urine culture, throat culture, comprehensive metabolic panel, and HIV were all top sendouts. When we're evaluating expanding services and what may make sense clinically, financially, and operationally, it's important to understand the cost of testing versus the effect on patient outcomes. And obviously, we want to factor reimbursements or the money that you would collect for these lab tests, but it's really important. Volume drives demand in terms of financial justification, but we also want to factor in the cost versus patient outcomes. I talked a little bit about this earlier, but barriers barriers to care. So when we look at expanding services, we're seeing a trend or a shift in some of the services that urgent cares are offering today. I'm not going to go through all of these, but 50% of counties lack an OBGYN. More than 100 million people in the US do not have an established PCP, a primary care physician. This is really driving a need for urgent cares to look at servicing this market, or at least looking at the trends to see if this is something that makes sense. We've met with urgent cares that are not getting into the primary care market due to a relationship that they may have with a health system, and they have a great trail of referrals. On the flip side, there are a lot of large urgent cares and small urgent cares out there that have already gotten into the primary care market, really due to this statistic, just the shortage of primary care PCPs and patients not having established PCPs. So this is important if you are already in the primary care market or looking to get into that primary care market, understanding the patient demographics, what type of testing would we need to look at providing if you're managing diabetics or going to be providing cancer screening diagnosis. So it's important to see and understand these different trends and capitalize where it makes sense. Another avenue to evaluate for optimizing lab services is really understanding the hub and spoke model, having a designated laboratory space, the opportunity to offer a core lab space. This truly is 100% driven by volume, by patient volume and patient testing volume. The data here on the left, this was pulled from the urgent care consultants. It shows over 50% of urgent cares have more than 10 locations. When I talk about volume, patient volume, testing volume, this is kind of the sweet spot we do see where urgent cares have brought in a designated laboratory space of 10 plus locations. Again, there's a lot of factors that go into this, but patient volume and patient testing volume really drives this. It's important to understand if you have the patient volume, like how would this impact your patients and your business financially, operationally, and clinically? Along with volumes, it's also important to understand concentration of your urgent cares, where they're geographically located. Does it suffice to have a single courier service to courier samples to a designated core space? What's the required technology for the testing that we may be looking at? Staffing, what's staffing requirements for that technology, for the instrumentation? What are the regulatory requirements? But really, most importantly, too, looking at the return on investment, looking at that ROI and making sure it makes financial sense for the organization. 35% of patient volume in urgent cares is for infectious disease diagnostics. Expanding services and looking at offering PCR testing in the core lab can really help enhance the patient experience and drive revenue into the business. I think the big thing here is really looking to leverage the current patient base that your urgent care may have to realize untapped revenue that is being sent out the door today. We fully understand this may not be a perfect fit or perfect scenario for every urgent care, but it's important to understand what this would look like for your organization. Keeping PCR testing can be a win-win, whether this is near patient or in a designated core laboratory space. Lastly here, before we jump over to the impacts of optimization, leveraging new technologies. So understanding the technology that's in the marketplace today and how this can play a role in operations and really helping increase patient care while driving revenue into the urgent care. Over the last, I would say 2 years, there's been multiple IVD vendors that have now been able to deliver STI testing under a CLIA-waived licensure. Folks like Binks, Visby, Roche, able to deliver chlamydia, gonorrhea, trichomonas, mycoplasma genitalia in as quick as 20 minutes via gold standard technology PCR testing. So it's important to understand, like I mentioned before, STI testing was one of the largest sendouts in the urgent care market. So what would this look like to patient care and to revenue for the practice if we were able to bring and offer this service for your urgent care? True point of care cartridges for CBC testing. The instrument in the bottom right, this has FDA clearance for point of care use. This is a cartridge-based CBC platform, meaning it's very simple and easy to use. Being FDA cleared for point of care, laboratories could look at performing IQCP, so running controls once a month or once every new lot. A lot of advantages to new technology here in a cartridge-based CBC platform. Middleware connectivity, waived point of care instruments for hepatitis C, bacterial vaginosis. These are all new instruments and new tests over the last 12 to 18 months that we are able to deliver under a CLIA waived license. In high-sense troponin, there's 2 instruments on the market now over the last 6 months that do have FDA clearance for a point-of-care high-sensitive troponin. So it's really important to stay up to speed on the new technologies in the market and how this could potentially impact your patients and in business. All right, now we're going to flip and talk about the overall impacts to the organization from optimizing laboratory diagnostic services. As I talked about a little earlier, urgent care market is a patient satisfaction industry, and patient experience can make or break the overall business. Patient experience can also lead to patient retention, which can help drive and keep new revenue in new volume. There's also some financial benefits to the bottom line that testing can provide when vetted and implemented in accordance with the current landscape, the current practice patterns of the urgent care. It's important and a big benefit to be able to have more control over your patients and the costs that they incur. So, when we talk about patient experience, this can really lead to positive patient experience. I've heard this before and hear it quite often, that samples being sent out to a lab, Aunt Betty may have gotten a $900 charge from this laboratory for the sample that we processed. So, being able to have more control over the costs can lead to a positive or a more positive patient experience. Making services faster, more convenient, and accessible. This can lead to loyal customers too and word of mouth, which leads to referrals. I'm actually based out of Michigan, and our team is currently working with urgent care clinic here in Michigan. They identify themselves or share that they are like an advanced urgent care. So a little unique offering. They offer CT, X-ray. They also have an on-site stat laboratory. So they're building a solid experience for patients, not having to refer them out. That's one of the things that they instill in their patients is not the number of patients that they have to refer out to a specialist is very minimal. And that all adds up to a positive patient experience. Online marketing and lab services and testing available. 90% of patients go online first when looking for new healthcare services. I'm actually going to read a review here from this clinic here in Michigan. This is from a patient. It's an incredible facility, and they were able to immediately run the lab tests that I would probably have had waited a week to get back. The owner actually replied to this review and commented, immediate testing, ER physicians, and a plan all in the same visit definitely sets us apart. So, again, a good example of on-site stat laboratory services that can truly lead to a positive patient experience, a positive patient review, and hopefully, obviously, lead to additional referrals as well. I've mentioned this multiple times, but the urgent care space is a patient satisfaction business, and online reviews and referrals are key when looking to drive volume. We did want to throw this in here, just talk about some stats. This is based on a single patient. So patient retention is obviously key. Working to put an educated guess average number on what this could cost in urgent care based on one patient. So the average patient who uses urgent care has 1.7 visits per year. That's 17 visits in 10 years with an average revenue per visit of $135. So that's what this is based on. This is also factoring in a sphere of influence of 10 people. I'm sure some folks on the call probably have an influence of well over 10 people, a family and friends. Some may have less than 10 people, but looking at that, and a single individual could be worth almost $23,000 to the urgent care's bottom line. Again, factoring in a sphere of influence of just 10 people. You can see how this is broken down here, but over 10 years, obviously, this could add up to hundreds and hundreds of patients, if not more than that, and can mean a substantial amount of either retention or lost revenue. I wanted to talk briefly about the impacts on the business from a financial standpoint, kind of showing this by licensure. So I talked about CLIA wave testing and non-wave testing, which moderate and highly complex would fall under. But this gives a general idea of specific for STI testing, the number of targets that we can identify or that we'd be looking to identify under a waived, moderate, or highly complex license, the average cost per panel. When we talk about wave testing or point of care testing, we're generally talking about a little bit higher cost, whether it's individually wrapped, cartridge based, there's more costs that go into point of care tests versus moderate or highly complex, more higher throughput, mid to high throughput, we can drive down some of those costs. And then when we look at Medicare published reimbursement, you can get an idea of the potential net revenue based on CLIA licensure per number of targets for, again, this is for STI testing. I talked a little bit before about the core laboratory. Really, patient volume and patient tests really drive the financial decisions here. But you can see here for STI testing, there is some potential net revenue to be had for these services, and really significant patient volume can drive these numbers up significantly. All right, so we're going to jump over to talk marketing and creating a competitive advantage. So when we look at creating a competitive advantage in marketing, we've talked a lot about this already. Patient experience is key, differentiation, and investing in technology. So we'll touch on those. Offering immediate lab testing and diagnosis along with a plan can create a very positive experience. This is actually a picture from the urgent care clinic here in Michigan. They're running CBCs. The instrument in the middle there is a molecular device that they're running respiratory on. You can't see it pictured on the right-hand side, but that is, they have a device in here to perform their STI testing. On the far, it's a blurry, the blue instrument on the far end of the picture is a point-of-care chemistry instrument for their basic and comprehensive metabolic panel. There's a handheld blood gas instrument, and then on the far end, they have a point-of-care device for their cardiac markers. So they run high-sense troponin and NT-proBNP. Again, this type of stat and diagnostic service can really impact patient experience, patient retention, and drive positive patient outcomes. When we look at differentiation, one thing I wanted to point out here, really what differentiation is not, having decals with board certified physicians or x-rays or COVID testing or walk-in visits. A lot of that is really expected from our patients, but what differentiation can be is offering on-site laboratory services, being able to deliver results for patients, whether it's an STI or a confirmatory strep test that does not need to get sent out for a throat culture in under 30 minutes, in under 20 minutes. Having better control over the costs for those patients versus sending them out to a reference lab. But really the biggest thing, is not needing to refer patients out. So being able to deliver treatment plans and diagnostics while the patient's still in the practice within the urgent care. And lastly here, so investing in technology. This is a key step in being innovative and really helping to create positive patient experience. This data was pulled from UCC Urgent Care Consultants and showing the average urgent care today sees less than 1% of visits for STIs. And on the top percentile, you can see almost 4% of visits for STIs. I do see this shifting in the near future. Just like I mentioned in the new technologies, there's been a lot of shifts. There's new instruments out for STI testing under the CLIA-waived licensure. I do see this as a good opportunity to enhance laboratory services in the urgent care market. Technology continues to evolve at a fast rate, which is really allowing physicians the ability to offer testing that's traditionally taken 2, 3, 4 days, up to a week. The ability to offer that at the same same patient visit, and diagnose and treat all within the same visit. All right, so wrapping up, just in summary here, really understanding the lab diagnostics market will allow for physicians, owners, providers to make informed decisions to bring on additional services that can create an enhanced patient experience. And expanding services and investing in new technology can drive more patient volume, better care, and ultimately additional revenue, helping increase that rate factor as well. And lastly, evolving your lab diagnostic services can help enhance marketing efforts and creating a competitive advantage. So that wraps up the webinar here on lab optimization. We are now going to jump over to some Q&A.
Thank you, Brett, so much for going over that and giving such a great summary on lab and all the different options available to optimize urgent care centers. One of the questions we had come through is there an ideal number of clinic locations needed to support a successful lab hub and spoke model? Or is that something you help determine during your consultation process?
Yeah, no, that's a really good question. And like I mentioned, when I, was talking through that slide, 54% of urgent cares have 10 plus locations. And a general rule of thumb for our Medline consulting team, our laboratory team, that is kind of the sweet spot, that 10 locations. With that said, though, truly what drives the justification is patient volume and patient lab volume. It's not really the number of sites. So could we have an urgent care group with 3 or 4 locations that are just extremely busy and can justify really looking at that type of model? Absolutely. So I would say, definitely consult with a consultant to see what does make sense. But generally, we see it around 10 locations where it starts to make financial sense.
Great, thank you. Next question is, what should urgent care centers consider when deciding whether to invest in new analyzers or point of care devices?
Yeah, when you're looking to invest in new laboratory diagnostic equipment and point of care devices, you really want to look at the costs. Obviously, we need any decision to be profitable for the overall organization. So we really want to look at the cost. And when I talk about cost too, not necessarily just cost per test. This is really where I think having a good consultant and transparency is key, understanding what the capital cost is, but also the ongoing costs, whether that instrument has a service plan associated with it. But the cost per test, there's also going to be consumables and disposables and controls that need to be ordered. So really looking at the return on investment. We typically, when we're doing a return on investments, it's a 60-month ROI. So we like to show the return on investment over 5 years, but looking at the capital outlay along with the operational outlay. So from a financial standpoint, that's first and foremost what we want to look at before making decisions on point of care devices and new testing. But we also want to understand what type of impact that specific instrument or those tests that that instrument delivers, how is that impacting patient care? How is that going to impact our patient outcomes and patient experience? There may be a test that is a top send out, but if it's not going to truly have a big positive impact on patient care and patient outcomes, that's where we need to just make the decision is, does it make sense to bring that into the urgent care?
Great. And going off of, your discussion of that balance, how do you recommend urgent care's balance the need for rapid turnaround time with cost containment in lab testing?
Yeah, one of the questions that our team asks providers and clinicians is really understanding the tests that they're looking at, but also, do we need that stat? So if there's a test, again, that's high volume, but it's not needed stat, it might be just a routine test that doesn't need to be turned around quickly. But also, obviously, factoring in the cost with each of those is really important when determining what makes sense to offer in your on-site diagnostic services. Hopefully that answered the question.
Yeah, I think that was a good answer. Next question we'll move on to is, if our clinic is looking to move to moderate complex testing, what type of assistance can you offer us?
Yeah, so Medline, we have a team of my team of laboratory solution specialists and consultants, but we also have a network of consultants across the country, based in Florida, Pittsburgh, California, Denver. They specialize in supporting not just urgent cares, but physician office laboratories in moving from CLIA waived to CLIA moderately complex. What's unique about our services too is it's very a la carte. We do have a turnkey solution, which is a one-time charge, right? That we basically will do everything for you, from filling out the paperwork, finding a laboratory director, making sure that everything is completed, but also we offer a la carte as well. So depending on what your needs may be, every practice may be a little bit different. There may be some parts of moving from wave to moderate that you and the urgent care and the team may be able to complete. So we can customize our consulting services too to meet the needs when looking at moving from waived to moderate.
Great. And a follow-up to that question then is, if we're interested in getting the Medline team engaged with our clinical team to discuss some of these areas of improvement or adjusting to a different level of testing, is there a cost associated with this?
Yeah, no, it's a good question. So for our services to move clients from waived to moderate, there is a cost associated with that. And like I said, it's we have a kind of one size fits all approach, but we also do a la carte. For Medline's consulting team, though, when we look at consulting on current tests being sent out, when we consult on workflows, when we put together pro formas, there are no costs to get Medline's team engaged and involved. That's what our laboratory consultant team is here for. We're meeting with customers and clients all day, really trying to better understand how we can improve patient care, but also deliver more financial benefits. So there's absolutely no cost to get our Medline consulting team involved.
Thank you. I think we have one last question for now, but again, anyone can submit more questions if you have them. But last question we have here is, are there emerging technologies that can help urgent cares streamline lab operations or reduce error rates?
Yeah. So there's, I talked a little bit about one of the platforms in the market today that is a point of care CBC platform. This is cartridge based, which is a little bit unique. That also is, in theory, to prevent errors and sample transfer errors of the traditional CBC method. So absolutely. I mean, there's new technologies that are continuing to come to market that are offering simpler workflows, quicker turnaround times, all while trying to reduce errors and reduce the need to redraw patients, have patients come back in for that swab or that draw. So yeah, I would say as technology continues to change, that is definitely a big component that we like to deliver here is helping reduce errors and the need to get patients back in for a redraw.
Thank you for that. And those are all the questions we have submitted. So I think the last thing would just be, how can we get a hold of you if we have more questions?
Yeah, thanks, Amber. I just put up my contact information on the screen here. Feel free to reach out if there are any additional questions. I have my email and cell phone up here. But yeah, no, I appreciate the time. Again, thanks to NERUCA team and the sponsors here for the time. Thanks everyone for joining, and look forward to hearing from you.
Thank you so much, Brett. I'm happy to close us out. So to Medline and to Brett and to Amber during today's presentation, thank you so much for partnering with us on such an important topic in urgent care medicine. It's been an absolute pleasure learning from you today. And to all of our attendees, thank you so much for your time and attention during today's webinar. We hope that you found this session insightful and valuable. And if you do have any additional questions or if something comes to mind later, please don't hesitate to reach out to us at admin@neruca.org as well. We're always happy to continue the conversation. Now, like I said, the recording from today's webinar will be available on our YouTube channel in the coming days. And we really appreciate your participation, and we look forward to seeing you at our next session. Have a great day.